What practical things can we do? I want to make sure I leave you very practical things. One of the challenges I find is lots of people talking ambiguities and vague. And, I'll admit last week's show probably a little bit of that because it's hard talking about marketing because it can go a million ways. But I want to give you a couple specific things you can do with every single patient. So if you're not taking notes, you better be or you're going to miss out. You can hit rewind probably. First question, rate your smile 1 to 10. How would you rate your smile? 1 to 10, 10 being perfect. What do you think the average patient's going to say? Do you think anybody's going to say 10? My guess is no. So the follow-up question is always the most important. People always think you got to ask good questions. I think you have to ask better follow-up questions or you miss the boat. The follow-up question is, what would make it a 10? Because you know what they're going to do? They're going to tell you every single thing. They're going to be way more critical of themselves than you would ever be or could be without offending them. With a simple follow-up question, what would make it a 10? What would give you a Julia Roberts smile? Which I just saw. That thing was insured for $40 million or $100 million. I forget what the number was. It's crazy. But NLP is all about how to use imagery to drive emotion. So if you look at a woman and you go, hey, what would give you a Julia Roberts smile? Because what does every woman want to be? They all want to be pretty woman. They all want the fantasy. They should. There's nothing wrong with that. They want to gain pleasure. They maybe want to get away from the pain of their own life right now, and they want to gain the pleasure of being pretty woman. I promise you this stuff works. So what would give you a 10, a Julia Roberts smile? Some other things. I'll give you a few examples. Had a client in Arizona a couple years back, and real high-end practice. Interesting story, because this is exactly what you guys are about and what you want to learn. This doctor, what was fascinating to me is when he hired us, he was a single doctor. He had 2 hygienists, 3 assistants, 3 front desk, doing $2.2 million 4 days a week. He says, I will hire you if you can get me to 2.6 and cut a half day out. I said, done, I can do it if you're coachable. He goes, yeah, of course. And let's face it, someone who's doing this sort of dentistry, this volume of dentistry by himself, proud, nice way to say it. He's a good guy, don't get me wrong, he's a good guy. But he's not shy in confidence. So there's this one day I happen to be in his practice with one of my coaches. He's going in to do a hygiene exam with a patient who needs an implant on lower right, forget which number. And he said, I've been talking to her for a year and a half about this. I can't get her to do it, blah, blah, blah. And I said, well, let me see the chart. So I pull it up on the computer and I look at it. And so I was like, before you do the hygiene exam, come see me. He's like, all right. So he comes to see me. And I said, all right, outside of hygiene, whatever you're going to discuss relative to hygiene, relative to this implant, I want you to say one thing. He goes, okay. I said, will you do it? He goes, yeah, of course. I said, will you do it? Right? Future public declarations lead to future actions. He said, yes. I said, okay, great. I want you to look at her and say, hey, relative to this implant we've been talking about for a year and a half, when I'm done with you, I'm going to give you the smile of a 22-year-old girl. And then turn around and walk out. He just laughs. He's like, that's ridiculous. I said, you promised me you'd do it. He said, I'll do it. So he does it. He walks out. No idea what happens. We go to dinner that night, talking to his wife who was in the front desk. It was one of these questions of, hey, what happened to this patient? I forget her name. And she goes, oh, she's scheduled, paid. He's like, you have to be freaking kidding me. I've taken every single implant class. I've done this, I've done that, blah, blah, blah. What in the world? Why did that work? I said, well, so you're used to treating a tooth or maybe a smile. When I look in the chart, I don't see a tooth. I see a person. I see a 40-something-year-old woman who's divorced, who, for all I know, lost her husband to a 20-something-year-old girl and is pissed. So what I see there is someone who desires something different and who is willing to do something to get that thing they desire. You're not looking at the right things. Quit looking at tooth numbers. Look at someone's age. Look at their circumstance. Look at their story. Understand their story. Offer them a solution to their problems, their challenges. You'll have patients for life. You'll have patients who will say yes. You'll have patients who will pay cash. 12 months later, this doctor's at $2.6 million, and he's working 3.5 days a week. And it wasn't because we taught him how to do more composites fast. Can't do it at that level. Doesn't work. Single doc. He's doing it all himself. It was all in the big cases. We had to teach him how to present his cases differently from a psychology perspective. Your case presentation for big cases is going to be 1 page long. Smile makeover, smile transformation, whatever you want to call it. Here's the fee. In fact, I wouldn't even put a fee. I'd put a monthly payment amount. Because how do we all think? Monthly payments, right? When you buy a house, do you shop for a $500,000 house or do you shop for a payment that you can afford? When you shop for a car, do you shop for an $80,000 car or do you shop for a payment you can afford? We all shop and think of monthly payments. Give them the monthly payment. This is how everybody thinks. Your patients are the same. He goes, well, what if the fee changes? Because, this is going to take 6 months, a year. I said, you're a freaking doctor. Get it right, man. You're a professional. Get it right. Give them certainty. Hey, Mr. Patient, here's your fee. Here's what it's going to be. Now, there's some variables that could come into play here. If any of these come into play, it's on me. It's not your problem. I'm a professional. I should be a professional. I should be able to get this right. I realize there's some variability, but I think I'm pretty darn close. And if I'm wrong, it's not your problem. It's mine. You'll give them certainty. You'll give them appreciation. You'll give them confidence that you know what you're doing versus, well, it could be this. Maybe I need a sinus lift. If you're doing digital dentistry, you should know all this, of course. But there's still variables that take place, right? So give them certainty. Your case acceptance rate will improve a lot. I'd love to spend a whole lot more time on this because I could go into this for hours and hours. And usually when we do a full program, I am on this topic for hours and hours. But I wanted to keep this short and sweet and give you a few actionable nuggets that the digital enamel team and any of the AM clients can take and use today. I hope you took notes. If you have questions, email my team. Get your questions to us. You want to see another show for your digital enamel audience, get them to us, man. We'll love to do it. Love to keep sending you guys some content. It'd be awesome. I hope you've enjoyed the show. I can't wait to see you next week, 8 o'clock Mountain, 10 o'clock on the East Coast. Until then, have a great day.
What if you could have the practice of your dreams? What's holding you back? Imagine a life where you have everything you ever wanted.